All right. So again, this is Dan Toner, the health insurance broker. We're here to talk about the upcoming renewal that is for the Focus Interior Products Health Plan. Those of you that know, we are with Horizon Blue Cross Blue Shield for medical. We are keeping that same policy. There's a couple of changes I'm going to go over with the coverage. Not too many. And I'll just some positive stuff, and I'll go over that. If you wouldn't mind muting your phone for me, that would be great. And then on my screen, I'm sharing the medical, and we're going to go over the new dental and vision options. I'm also going to pull up on screen, just give me 1 second, a copy of our portal called My Benefit Link and Agency Smart. So this is my portal. I've emailed you already right before this call started to ask you to go ahead, click on the link, check spam just in case it went there. But I have emailed you a login that you just click on. When you get in, you'll set up your profile. Just take a peek at the spelling of your name and address. Some of you that are new, I did not have dates of birth, so you just have to put your date of birth in. And then you'll move forward. If you're staring at the screen, you'll notice that you'll see the Omnia Blue Cross plan. If you're enrolled on it today, it'll say you're enrolled. You can click modify enrollment if you're going to add a dependent. It'll also show that you probably waived for dental because we never had dental before. And it'll ask you to select enrollment. On each of the products, dental and vision, you can see there's a little info button. And if you click on that, it'll give you some details about the coverage. So for example, on the medical, if you click info, there's a little benefit summary at the top that you can see all of your coverages. And then it'll let you go ahead and modify your enrollment to show, again, what your cost structure will be, more so for the dental and vision, and that'll be broken out. So I'm going to go over the benefits with you, but just take a peek if you're at your emails, if you don't mind. And you should be able to go in and log in and make your elections for this year. We're going to leave open enrollment for a week. That should be enough time, Kelly, in my opinion, that your team should be able to go in, make their elections. You can always have the staff call me, Kelly, with any questions. And then my team, Joe Genova, on the back end in my office, he'll be making sure that he communicates all of this information to Blue Cross Blue Shield next week. And then the new policies and the renewal for the medical will start on May 1. So I'm going to dive right into the medical. The contribution structure, I believe the company Focus pays 100% of your rate if you're a single. So clearly, if you're going to add dependents, you can do that. So on my portal, if you want to add a spouse and children, the portal will show you what Blue Cross will charge you for those. Otherwise, you should see a zero cost for the medical. We have the silver plan. On the screen, you'll see there's 2 levels of coverage for what's called the Omnia. Blue Cross's website, which is, and I have a link on my portal, horizonblue.com, will let you go in and check and see if a doctor is credentialed as what's called a tier 1 or a tier 2. Blue Cross determines that. So for example, on the screen, I'm highlighting the PCP copay, primary care physician. Note that from last year, which is the current plan on the left that I'm showing, you had a $35 copay. DW means the deductible was waived. You had a $35 copay if you went to a tier 1 primary doctor. That is now lowered to $30 on the May 1 renewal. Blue Cross sometimes makes positives or negative changes to their products. This year, they just happened to lower the copay. You'll also notice tier 2. 50% AD after deductible. So the concept of the Omnia is telling you that you're highly incentivized to see tier 1 doctors, hospitals, and facilities because your coverage will be better. Can you see tier 2 doctors? Absolutely. You're just going to owe more. In other words, you're going to owe a $2,500 deductible and then 50% of the bill. It's still covered, but you're going to owe more. Now, Blue Cross can get away with this concept, and what I mean by get away with is there are so many tier 1 doctors and hospitals and facilities that it's a very popular, as a matter of fact, it's probably the most popular plan amongst all the carriers, and amongst all the Blue Cross Blue Shield products in New Jersey right now, this Omnia Silver is their flagship product. So again, when you go to a tier 1 doctor, you pay a $30 copay. You do not need a referral to see physicians. If you go to a specialist, you pay a $60 copay. And again, that deductible is waived. You only owe the copay. They pay the balance at 100%. I'm going to skip around a little bit. Your lab work, your x-rays, you pay $0 if you're using a tier 1 provider. Good example, LabCorp is probably one of the largest lab facilities. If your doctor sends your stuff out to LabCorp, that's a tier 1 provider. You pay nothing for your lab services. The $1,300 deductible that you see at the top of the screen, what that applies to is if you go to a tier 1 facility and you have things like hospitalization, meaning you stay overnight, surgery, radiology, like an MRI, CAT scan, or PET scan, or emergency room. So your bigger claims, you're going to owe the first $1,300. That's called your calendar year deductible. You meet it one time for the calendar year, not May to May, calendar year. Once you meet that deductible, Blue Cross is then going to tell you if you are seeing tier 1 facilities, you will only owe a small copay. For example, outpatient surgery is a $250 copay once you met your deductible. Doesn't matter what the surgery costs, you only owe $250 once you've satisfied your $1,300 deductible. If you go to the emergency room after you meet your deductible, you only owe $100. If you're in the hospital, you will see a benefit that says $500 per day times 5. What that's meaning is I've met my deductible and I only owe $500 for the night or the day, 24 hours that I'm in the hospital. The next day, if I stay another day, I know I owe another $500. But after the 5th day, they won't charge me any more. So if I'm in the hospital for 10 days, for example, I owe $500 for those first 5 days, which is $2,500, and then I'm done. I owe $0 after that point. So the times 5 is really to protect you and say if you're in the hospital for a longer period of time, they won't keep charging you the $500. So that's a built-in positive benefit. I want to make a comment about what's called the maximum out-of-pocket. MOOP is what a lot of people refer to it. Maximum out-of-pocket means whatever you pay. If you go to a tier 1 and you pay a copay, or you go to tier 2 and you pay a deductible of $2,500, whatever your copays are after the deductible, Blue Cross has to guarantee a maximum out-of-pocket. That's the most you would pay. Now, the term maximum out-of-pocket for this product is $8,550. So what they're telling you is that from January through December, the most your copays to the doctor, hospital, pharmacy, the most that could be is $8,550. I will tell you that on this plan, it's very hard to hit that number because you have such good coverage. But the out-of-pocket is your potential worst case scenario. Doesn't mean you're going to owe $8,500. It just means that's the most you're going to owe. Okay. 2 other benefits I want to highlight. Prescription. Pulling it up pointing down to it on the screen. $20 is the maximum you pay for a generic drug at the pharmacy. Many medications are less than that. So with the power of Blue Cross and their rate negotiations, many times you go into a pharmacy and it may be $2 for a generic or $8 or $12, but the most you will pay is $20. There is no deductible. Name brand has a $250 calendar year deductible. So you have to meet that first, then you pay 50% of the drug. So you're heavily incentivized to get generic, but you can get name brand and pay half the cost. The $250 max that you're seeing on the screen is a benefit that's added on May 1. Last year, which is your current plan up to the end of April, you paid 50% without a limit. Now they're guaranteeing that your 50% payment will never cost you more than $250. So the point here is that if you have $1,000 medication, you can't spend 50% of that, which would be $500. You can never pay more than $250 at the pharmacy. Again, that has to be a pretty expensive drug for you to do that, right? It's got to be at least $500 for you to hit that $250. So a lot of people get lower costing name brand drugs as well. So it's a 50% benefit, guaranteeing you'll never spend more than $250 for that month. The last benefits I want to highlight are your emergency room versus urgent care. You'll notice on your benefit summary, there's a $75 copay and the deductible is waived if you go to urgent care. There's a $100 deductible there's a $100 copay after you meet the deductible for emergency room. So they're heavily incentivizing you to try to use those urgent care facilities. So I want to stop here because before we go into dental and vision, does anyone have any questions about Horizon's Omnia plan? Okay. I'm going to pull up the new voluntary dental. Voluntary means it's paid by the employees. When you go into our portal, it's going to break it down per paycheck. Very, very affordable dental option and very affordable vision. Voluntary meaning we only need as little as one person to participate. So we thought this would be a great plan moving forward starting May 1. On the screen, you'll see the name of the plan is called the Dental Option Plan. Blue Cross has a couple of different networks. The Dental Option, DOP, it's nicknamed, is their largest network. But the good news is you have coverage whether or not you go in network or out of network. And dental, I don't know if everyone's had dental before, but dental comes in usually three major categories, benefits. First is diagnostic and preventative. That's where your office visits, your exams, your x-rays, your cleanings. They pay 100% of the bill for you. You pay zero. For basic services, these are things like oral surgery or fillings. They pay 80% of the claim. You owe 20%. For major stuff, this is stuff like root canals, bridges, crowns. They pay half, 50%. You owe half, 50%. At the top of the screen, you will see there's a $1,500 maximum. What that means is from May 1 until December 31st, again, it works calendar year, they're going to physically pay out $1,500 for every single person you have covered under your family. If you're covered as a single, you're getting $1,500, which is a bucket of money. So an example would be if I go in twice a year for my checkups and cleanings, and let's say it's $200 in the spring and $200 in the fall, they're going to pay 100% of that. That's $400 worth of benefit. Now I have $1,100 left in case I needed to get other procedures. Many people see the $1,500 and go, it's not worth it. And I get this question a lot. The premium you're paying when you do the math, you're probably going to pay about $500 a year for this benefit as a single. Yet they're giving you $1,500 worth of coverage. And that's where a lot of people feel that dental is worth it. Okay? Any questions on dental? Keep in mind, if you waive coverage, you cannot re-enroll until May of next year unless you have a qualifying event. So if I waive coverage because I'm covered with my spouse and my spouse loses benefits in August, I can then re-enroll telling Kelly, hey, I have a qualifying event. If I get married, that's a qualifying event. So there are examples where you can come on prior to next May. But if you're waiving, just consider that you can't re-enroll until next May. One last thing on dental. I mentioned before, you can go out of network. So if your dentist does not accept the plan, you can still go, and Blue Cross will pay 100, 80, or 50% of whatever their rates are. So most likely you're going to owe a little bit more if you go out of network for a claim, but you can go out of network. Without any questions on dental, I'll go into vision. Again, voluntary. Blue Cross only wants as little as one person to take it, and then Focus can keep a plan for the year. So we're going to offer this on May 1. You'll see at the top what's called frequencies. When it says eye exam 12 months, what they're meaning is you can get one eye exam every year. You can get one lens every year. You can get a pair of frames every 2 years, 24 months, and you can get contacts every year. Vision can be covered under your medical if it's a medical diagnosis like glaucoma, for example. But if you don't have a medical diagnosis and you just want routine vision, you need a vision plan. It's not covered under your medical. And vision for a routine is really based on a combination of two things. It's a copay for certain items, and it's a reimbursement for others. So on the screen, you'll see a $10 copay for an eye exam. So if you want a routine exam for your eyes, you will go to what's called a Davis Vision. On the Blue Cross website, when you click on Look for a Provider and you click Vision, it's going to then tell you, hey, we're directing you to Davis Vision. That's their outsourced network, national network of vision providers. So Blue Cross doesn't have any vision providers. They use Davis Vision. So when you see a Davis Vision provider, you simply pay a $10 copay for your eye exam, and they pay the balance at 100%. If you're getting something like a pair of glasses, you'll see you pay a $25 copay for the lens. And then below in the allowances, you'll notice that you will get a $130 cash reimbursement plus 20% off. So that's what I meant by it's a combination. So a pair of glasses could be you only pay $25 for the lens, but you then get a cash reimbursement for the balance. And that's going to be the same thing as a contact. You're going to get cash plus a percentage off. You can go out of network, but I will tell you that with a lot of these vision plans, there's a dollar amount of reimbursement. They'll give you up to $40 for an eye exam, for example. You'll see that on the benefit summary, but try to use a participating vision provider with Davis. It makes life a lot easier. Okay? So that's all I had in terms of the plans. We're renewing the Omnia Silver. When you log in, if you're to my portal, if you're covered today, it'll say you're enrolled. You can click modify enrollment if you want to add a dependent or waive. So make that choice. You'll see dental and vision. Click modify enrollment if you want to. We need you to go in and either have it elected coverage or sign a waiver. And the waiver is right on the screen, and you can use your mouse to digitally sign. And Kelly, that's how you and I will get copies of everybody's applications and waivers. So that's all I had. I'm going to open it up for questions now.
I just had a question, like overall with everything.
Mm-hmm.
So I am doing 30 hours a week now because I'm a student